My name is David Blank. I want to wish everybody a happy 4th of July. Welcome to all the Tea Party participants, all the people who are raising our voices in what has to be arguably the most, or at least the largest, ignored movement in the history of the USA. But they can keep ignoring us right up into 2010. Welcome to everybody else who's here to watch the fireworks, which will hopefully be going on in a little bit. If you're not here originally with the Tea Party, we hope that you are getting some information and at least considering kind of tagging on. We do have the greatest country in the world, and we have the greatest country in the world not because we have the biggest government, not because we have the greatest leaders or the most empathetic legal system. We're great because our founding fathers set up a system of government that allows us the freedom to be whatever we will be. My dad worked for GM. My grandfather worked for GM. I went on to become a doctor. And it's that way with anybody. You don't have to follow in your dad's footsteps if you don't wish to. I'm an emergency room doctor. I am not a spin doctor. We'd probably all be a lot better off if there were more of the former and few of the latter. I'm going to be talking to you a little bit about healthcare. Most of what you are hearing is a lot of spin. You're getting a lot of spin from both sides, unfortunately. I'm only going to talk for a few minutes because I am not a politician, and a few minutes is all that I need. You do know politics is a Latin word. Poly, which means many, and ticks, which are little blood-sucking creatures. This talk is a little different than some of the others because healthcare is on the table right now, but they actually haven't passed anything. They actually haven't made any decisions. When it comes to healthcare, they are promising change, change that we can all believe in, and believe you me, change is coming. Some change in the healthcare system actually is needed. We all kind of agree on that one thought. Some of the changes is going to be good. A lot of change probably is going to be very worrisome. My real question is who should be making the decisions on where those changes come from? The changes that certainly are needed before the whole Freddie Mae Fannie Mac disaster, which actually was probably brought on by meddling in the lending market by our government. The number one cause of home foreclosures in this country was from medical illness. And we pretty much should all agree that in the USA, no one should lose your home if you're sick or if you're injured. We do need to develop some type of a better safety net to catch those people. But a lot of the ideas that are currently being tossed around, and these are by the same guys who wrote the TARP bill, the stimulus bill, the auto industry takeover bill. You know, I don't know what school they all went to become experts in every field of everything. But, you know, it's the same handful of guys that are writing all this legislation that covers everything. Their ideas really are going to change the face of medicine in a lot of ways, though. The unfortunate news is even if this reform package does not pass, a lot of these changes are coming. The thing that most Americans don't understand is that the government already runs 50% of the healthcare industry. When you add Medicare, Medicaid, and the VA system, 50% of everybody I see in the emergency rooms belongs in those government programs. And so when they come out and tell you this system is broken and we're in this terrible crisis, and of course every day there's a new crisis, this is a system that really is of their own making. Just as kind of an aside on the topic of crisis, I'm not really seeing any more uninsured patients in my emergency rooms today than I did 5 years ago or 8 years ago. Those numbers are not going up, so this is not some emergency crisis that if we don't pass it in the next month, somehow everybody who's standing here is going to keel over dead. This is something that's been ongoing for a while. Like I said, it's been talked about for a while, but this is something that cooler heads can sit down and talk about and come up with a decent plan instead of trying to rush this through. Now, in his speech to the AMA, our president said that our reimbursement system is a model that has taken the pursuit of medicine from a profession and turned it into a business. But like I said, that whole model has been driven by the government itself. For years, you've heard that Medicare and Social Security are both on the verge of bankruptcy. Who knows when exactly that'll happen? The year that it's running out of money changes year by year. Right now, they're saying that it's going to be bankrupt by about 2017. Now, all of you who are working are paying into that system, not into some fund that's going to take care of you when you join the Medicare system. All that money is paying for the people who are getting Medicare right now. We call that a Ponzi scheme. And right now, Madoff just got 150 years. All the guys that are currently putting this one together are going back to Washington, unless we do something about it. In fact, Congress actually wants to expand this program. They can't pay for the people that are in it now, but somehow they're going to add more. And how can we possibly pay for this? The president actually has already told us. He came right out and said, I'm going to cut cost. And how's he going to do that? I'm going to cut payments. This is how it's worked out so far for those of us in the healthcare field. You do the same work that you did before, now you just get less money. And I'm actually doing more work than I did before. Just in the last few months, Medicare, shortly followed by Medicaid, came out with some new rules where, well, I'll back up. I used to see patients, and I would have medical school students, people in training, that would do the charting and the paperwork for me. They would discharge the patients when we were done, when we got all the diagnosis figured out. Medicare now says that's no good, and that's not good patient care, and I personally have to fill out all the paperwork, to the point where they will even look and match up my signature with the handwriting in the chart, and if it doesn't match, they won't pay me. So I'm now finding at least an hour of every shift I work, sometimes more. I'm sitting at a desk filling out paperwork when you're out waiting in the waiting room of our emergency rooms. And that's not just something local, that's a nationwide thing. But that's how the government does things. The definition of a government job is when the process becomes more important than the product. Medicaid also, which is partly state-run, has also set up a complete mess of rules that put the burden of decision-making on the patients, which a lot of times are the poorest and least educated people that are in society. One of the worst is they allow you to pick your doctor. And so say you pick the doctor you've always seen, Dr. Jones, but Dr. Jones is in the Methodist system. Well, if you get sick or your child is ill and you live across the street from St. Francis, which is where I work, if you go to that emergency room, Medicaid won't pay me. You're supposed to make a decision that you go down to Methodist in the middle of the night, which is a ridiculous system, and it's a system that's designed to put patients and doctors at odds against each other, because now I'm telling the patient, well, you're in the wrong spot. The patient doesn't really care because it's 2 a.m. and their 2-year-old is sick. And at the end of the day, Medicaid doesn't pay. It's almost like a scam that they've set up, and it's not right for anybody.